The actual implant crown is the most critical part of the implant because that's what our patients are using to chew, talk, and function with. So that's just as critical as the actual implant itself, but more critical when it comes to the function and the aesthetic of getting it all together. I tell my patients the implant crown is the house and your implant itself is the foundation. The difference between a high quality implant crown versus a basic implant crown is just that when we're dealing with an implant crown and we're looking at the lifelong longevity of this crown, we are using the highest material, using the highest lab technician to be able to recreate what you were missing. Duplicating what a patient was missing there is the most critical thing. We're not just talking about filling in a hole. We're filling in a function, the feel and the touch of what they had before. So it's very important to look at that detail and be able to be the architect in rebuilding what that patient had before. A lot of times it's a guessing game. So that's why it's so important to make sure that we're using high quality material and ceramics to recreate what you had there before. When we're designing an implant crown, we use a digital scanner so that we're able to capture every detail of the area that we're restoring so that we can make sure that we match the adjacent area as well as be able to replicate what was there before so that we can make sure that the patient is seamlessly using and be able to function and clean that area just like as if they had that tooth there all along. There's a lot of things that can go wrong if your implant crown is not planned out carefully. There's a lot of things that we take in consideration when we plan out an implant crown. We're taking consideration the space, the function, and how you're caring for that. So if the implant crown is made where it's not seamlessly in that area, it can cause a lot of issues with keeping the area clean, for instance, and a patient could have lots of issues down the road that they can be developed because they're not able to clean that area properly. If an implant crown is not flush or fit perfectly, they're not able to actually chew or use it. So it's really important to make sure that we're not just filling in a missing tooth, we're filling in a function that should be seamless enough where if you had a natural tooth that was there, you're able to care for it, use it, speak, eat, and things like that. So it's very, very important that a lot of things, if not done correctly, could cause an issue with that crown. When we do implant crowns, just like any crowns, we're looking at the overall anatomy of the patient, not just that singular or hyper-focused area that's missing a tooth. Again, that's why we do all the records that we do in our office. And outside of just basic x-rays, we're doing digital scans, we're doing bite registration, and as well as full face photography from every angle so that we're making sure that we're harmonizing that restoration, whether it be an implant crown or anything, to make sure that it harmonizes with the rest of the mouth and the face. If you're a patient looking to do implant crowns, you definitely want to be asking your provider a lot of critical questions, such as how much exposure have they had to restoring implant crowns? What is their workflow when it comes to doing implant crowns, whether it be their treatment planning from beginning, during, and end? What is their plan to maintain and care for your implants? And what advice that they can give you for you to be able to maintain it yourself? A lot of the issues that patients have when it comes to implant crowns or any restorations for that matter is that it's not a one and done situation. You're not getting that procedure done and then the provider no longer has to take care of it. You no longer have to take care of it, and it's just a walk away situation. And that's never the case. When we're dealing with implant crowns or any restoration, it is a lifelong care with the provider, with the patient, in the office, at home, so that we can ensure that this is going to last as long as possible. Implant crowns typically last anywhere from 10 plus years. Lots of factors can affect the longevity of an implant crown. Obviously, always home care. How implants are still an actual thing in your mouth. So it still is subject to getting dirty, getting disease. So you still have to be able to care for it. So that definitely comes into play on how long it lasts. Other health factors. Are you a smoker? Do you have other health issues, chronic health issues that can be able to affect how healthy your body reacts to that implant? So lots of things that we consider before we even place an implant or suggest that an implant is a good thing for this patient is that we take in consideration how they're caring for the teeth right now, how their health is right now, and how their health and home care will be going forward after the restoration is done. So we are definitely one of those providers that we take that all in consideration before we even suggest that this is a good option for you. We really use the Pankey philosophy to impact all our treatment planning options, including implant dentistry. Pankey is all about the overall health of the patient, treating the patient as a whole. So when we're looking at implant dentistry, we are looking at not just replacing a missing tooth, because at the end of the day, that's what it is that you're missing a tooth. That implant is one of the options to do that. But when we're putting anything in the body, we want to make sure that person is a healthy patient. And that's what comprehensive dentistry is when it comes to Pankey philosophy. We're all about integrative dental medicine. So when we're looking at the medical health of the patient and the dentistry of the patient, that has to harmonize together. So the Pankey philosophy really allows us to look at that together and to make sure that we ensure this patient is going to be healthy and that dental restoration or that dental implant is going to be healthy for a lifetime.